Thanks a lot. Thanks for having me. I think we're running a little bit late, so I'll try to get through this a little quicker than planned. And basically, I was asked to come today to speak about the research behind the ketogenic diet and just diet and cancer treatment in general. I'm a radiation oncologist across the country over in Pittsburgh. I will try to keep this, there's a lot of science here. I'll try to keep it as interesting as possible. If I am boring anyone, just raise your hand, just let me know. As someone who slept through 4 years of med school, I don't like boring lectures, so I'll try to keep this a little off of the scientific side of things. And since I'll try to get this over quickly, if there's any questions, we'll do it at the end, or maybe we could do it during lunch, but I drank a lot of coffee, so hopefully that'll help me get through this. I have no conflicts of interest. And briefly, my goals today, first and foremost, are to review the historical data on diet and cancer care. So you've heard a lot today about why we think diet matters. When you go out and talk to physicians, we need some data behind that. We need some way to prove it, and so I'm going to go through that. I want to convince everyone in here that diet and nutrition play a role in cancer care. I'm going to review existing data supporting nutritional intervention in cancer care, because there's more and more data coming out on a daily basis. And then I want to explore future directions of the diet and the management of cancer, one of those being the ketogenic diet. So first and foremost, if everyone could raise their hand, how many people in here believe that diet plays a role in cancer care? Just firmly believe in that. All right, good. So when I gave a similar talk 5 years ago, nobody raised their hand, and this was in a room of physicians. And literally by the end of it, they were throwing tomatoes at me. So I'm glad to hear that. Anyone in here, and we're not judging, but either not sure or doesn't believe that diet plays any role in cancer care? All right, so my work here is done. I'll see you guys later. I'm going to head home. So as a radiation oncologist, I see patients during radiation treatment every day, basically Monday through Friday for around 6 weeks. I check in with them at least once a week, and it really gives me an opportunity to meet these people, meet their family members, discuss all aspects of life with them, just really forge relationships. And during my training, I noticed over and over again that the two most common questions that I would hear would be, can I drink alcohol during treatment? And what should I eat? And will different foods interact with my treatment? And interestingly enough, as the two most common questions that I hear, you think we would have some answers to these questions. And it really set me back when I found out that we didn't. Well, we didn't for number two. For number one, there actually is, and I've always bring this up in my presentations, there actually is a study looking at wine consumption during radiation treatment. So my two focuses are on breast cancer, and my other focus is on CNS, or brain lesions, and exercise and diet. And this actually was a study showing that you, in fact, can drink wine during radiation, and 1 glass of red wine actually decreases, this is not in pediatric patients, of course, but decreases the side effects of radiation. And in this study, they found that women that drank 1 glass of red wine a day had decreased skin effects from the radiation. Now, if you drank more than 1 glass, those benefits started to fall off. But lo and behold, there is an answer to this question, but not an answer to what we can eat. As a side note, I'm Southern Italian, and this study did take place right there, which is one of the top wine-producing regions of the world. So clearly biased, but nonetheless, as a wine lover myself, I love discussing this study with my patients. So the fact that we couldn't answer that second question, what foods will interact with my treatment, and that goes either way, making it better or worse, we started to look into this. So we put a survey out to all of our patients, asking them whether they cared about diet, whether they cared about exercise, what their thoughts were about these two topics, and if they went anywhere to get advice, basically, during treatment, because they weren't really getting it from their physicians. And lo and behold, most people went online. They went on the internet. About a third actually Googled what foods interact with radiation therapy during treatment. So what we did was we went to these sources. So we went to all the online sources where patients were going. And spearheading this, we went to the NCCN, and these are the accredited cancer institutes. So you have Harvard, you have Stanford, you have all these famous places. And we wanted to quantify what they're telling patients. So we looked at all the different foods that they're telling patients to eat, and then we looked at the percentages of the diet that they're telling patients to eat. And that's what this is. So the bottom there, the small checkers of all these places, that's the percentage of your diet that should be carbohydrates. So if you see the far left here, number 10 on there, about 68% of your diet they're telling people should be carbohydrates. On the far right there, number 31, they said about 18% should be carbohydrates. I have numbers on here because I actually published this paper when I was looking for a job, and I said some very inflammatory things about some of these places, and I was applying for a job there. So not the best tactic, so I just put the numbers in there, and that was actually at the urging of my chairman at the time. I had the names on there. So you can see they're all over the map, and these are NCCN cancer institutions, which only 4 of them even commented on diet, and then another 8 actually outsourced their dietary comments to other websites, which were even more heterogeneous, just all over the place. So if you're a cancer patient and you're about to get radiation and you're going to go look online and see what you're supposed to eat, it really depends on where Google takes you as to what you're actually going to end up doing. And on the left there, that's a very high carbohydrate diet. It's actually the opposite of what Miriam is telling us. And that's over, I don't want to say where, but it's around the Boston area, cancer center there. Nicely, if you come over to the west side on number 31, and I'm more agreeable with that, this is a little bit up north, they actually promote more of a high-fat diet. But at the end of the day, the data's all over the place. I thought this was a very interesting topic. I submitted it to the top cancer journal, and they rejected it in about maybe 3 minutes. It ended up getting published in a journal called Nutrition and Cancer. I was, as a promoter of diet and health and nutrition, and I was devastated that it just got immediately rejected. And here's what they said to me. These are 2 oncologists. They said it was rejected first and foremost because we don't have any data showing an effect of diet on cancer treatments or outcomes. I think this is probably what most clinicians believe. You know, maybe it plays a part, but the data is just not there. And if the data wasn't there, then that's a fine comment. I can't argue with that. The second one, that's the one that really hurt my feelings. Diet is unlikely to play any part in cancer care. Therefore, this article is irrelevant for this journal. Basically, you know, as a young boy, my grandfather pushed into me. He had an organic garden. He pushed into me that diet was so important. And then this guy basically just, you know, walked all over my whole background. So it was it really hurt my feelings. And it got published, and it was great, and it looked good on my resume, and I was happy about that. And then next thing I know, the ASCO Post, this is the American Society of Clinical Oncology. That's the major clinical oncology organization in the US, actually commented on this article in their monthly newspaper. The National Cancer Institute put out a flyer, again quoting this paper, saying, what are we doing? We need some answers. Medscape as well put out an article saying, we need to figure this out. We need to figure it out fast. Patients want to know. And most importantly, Sanjay Gupta, you know, at that point, you know you made it when Sanjay Gupta's backing you. He said the same thing. And funny enough, I'm not going to say which one. One of these places was interviewing me, and I mentioned a higher fat diet, and they said, whoa, you don't really recommend a high fat diet, do you? And I said, no, I don't. And they said, oh, that's crazy. Then they went on. Meanwhile, obviously I do. But anyway, I just didn't even want to go down that route. But anyway, so the fact of the matter is patients, parents, and the media think nutrition is important. So as clinicians taking care of patients, it's our job to figure out what this link is if that first reviewer is right. So if there's no data to show this, then we better make some data. Or if the data shows that it doesn't matter, let's at least come up with that. But right now, according to that guy, we have nothing. So the question I had then was there really no data to back this up? And it takes about 5 minutes and Google to figure out that comment is 100% wrong. This is a paper from Dr. Mareshi from 1909, and I won't go through it in too much detail, but basically he had 4 groups of mice, and he fed them differing amounts. And as you see here, he fed them what was the first calorie restriction study. And ad libitum is you can eat all you want. All you can eat all the time. And there's a group of mice that ate all they could eat all the time, and then there was mice that he gradually to 2 to 1.5 to 1 gram per day, restricted the amount of food they could eat. Then he implanted sarcomas, which is it's like a muscle-based tumor, onto these mice, and he found out that the ones that ate all they could eat all day long, their tumors grew to the largest size. The mice that he restricted their intake, their tumor was about 1/7 the size of those other mice. So there you go. There is a link between diet and cancer. The more you eat, the more your tumor grows, or at least in mice. So in regards to that first person who rejected my paper, this is 1909. It's the year Geronimo, the Apache chief, died, and it is the year that St. Joan of Arc was beatified. So it's amazing that it was rejected, and someone would say, and these are leaders of the world in clinical oncology, that there's no data that exists linking diet and cancer. Lo and behold, in 1909, the year Geronimo died, there's a study linking this. And over the next 110 years, the data just accumulated more and more. This is Peyton Roos, who won a Nobel Prize for showing the link between viruses and cancer. The year after Mareshi's study, he said, let's do this a different way. Let's give the mice, put a tumor on a mouse first, and then as if we were clinicians, the mouse is already diagnosed, and then let's figure out how to treat it. So he took mice with tumors already, and then calorically restricted them, and showed the same thing. The tumors grew much more slowly. That's 1910. Over the next 37 years, Albert Tannenbaum did a whole slew of studies, and he got a little more into it. He weighed the food, he weighed the mice, he looked at macronutrients. So he looked at fat, he looked at calories, he looked at protein, he looked at carbohydrates, and he saw over about a 50-year period that there was a 2 to 44 times lower spontaneous tumor growth in dietary restricted mice. So he did 2 sets of studies. Similar to Roos, he put a tumor on it and watched it grow. He also took mice and then would apply carcinogens, and note that those that had we'll just say a healthier diet didn't get cancer, about 44 times different. I couldn't find a picture of him. This is Albert Tannenbaum, who was a famous mobster in New York. So I had to put something in there. And most recently, about 50 years later, and there's quite a bit of data, so you can take your pick. Dr. Stephen Hursting took it to the next level. He took mice and said, you know what, we can't do this calorie restriction. That's not going to go over so well in humans. Let's do a fast 1 day a week. So 1 day a week, he didn't let the mice eat, and they showed similar benefits, decreased cancer growth, et cetera. And he also started measuring this thing called IGF, and that's insulin growth factor. And going back to what Miriam was talking about, when you eat carbohydrates, your blood sugar goes up, and if your blood sugar goes up too high, it can actually be fatal. So your body secretes insulin, which quickly pulls sugar from your blood and puts it back into the cells. And that's how we stay what's called homeostatic. And when that happens, so when you eat carbohydrates, sugar goes into the blood, insulin is secreted, and also this thing IGF is secreted. So just remember those 3 things. And he showed that if you do fasting, it decreases the amount of that insulin or IGF that's floating around. And I'm going to come back to why that's important. Here's just another way to look at it. So these are just 4 of the main, Berrigan was in his lab. These are just 4 of the main studies, I think. So again, over 100 years of data. And now if you take a closer look at Tannenbaum's studies, and this is what he presented in 1947, and this is bringing in what Miriam was saying. If you look closely, and this was lost on, no one's ever commented on this. This is literally drawn in with a pencil, but he took mice, and the black line up there is the amount of tumors that would form in these mice that were eating an ad libitum diet, so they could eat whatever they wanted. And then that's in the black. And the etched part below there are the tumors that happened in these mice that were dietary restricted. And you'll notice the C's that he put on top of all of them, that was when mice had carbohydrates restricted, not just calories. And you could see there's quite more of a dramatic drop-off in cancer incidence when mice had carbohydrates restricted as opposed to anything else. And in some of these studies, if you look closely, not only were they not calorie restricted, but the carbohydrates were removed and actually replaced with fat. So in some instances, these mice may even have been eating more calories, yet there was less tumor development. So again, it's really showing that carbohydrates come into play pretty strongly here. And it's likely because of those 3 things I talked about: insulin, IGF, and then blood sugar. Not to belabor the point, this is 1929. Dr. Herbert Grace Crabtree wrote a dissertation on the observation of the carbohydrate metabolism of tumors. At this point, we started to realize that cancer cells feed on carbohydrates, and it became very obvious to these guys, and they started creating papers left and right discussing this. This man on the left is Warburg. I'm going to talk about him a little later on. He found that due to faulty machinery in cancer cells, they relied on carbohydrates and sugar for growth. And even, this is data in 1933, coming into my neck of the woods as a radiation oncologist. Radiation was one of the few treatments back then for cancer, and they actually started to realize that when more sugar was around and the more sugar cancer cells pulled in, the less effective radium or radiation was at that point. So that's 33 years, or that's 1933. So what they started to do was they started to look at some drugs and some medications and some chemicals that could block glycolysis. Glycolysis is the breakdown of sugar to get energy. And this one is 1940. So as far back as 1940, they were trying to block sugar uptake in cancer cells. And then this is a study, the graph isn't so important, but they were using a drug called 2DG. And this was basically, it would be taken up by cancer cells and would block the ability of glucose to be burned into energy, and they saw a much decreased growth of cancer cells at that time, and that was it. And then World War II happened. The one guy disappeared. I can't find him. I don't know what happened. The genetic play on cancer kind of took over, and metabolic treatments pretty much stopped at that point. And that's kind of why the first person on there says there's no evidence of data, because they didn't look enough. And I guarantee if you go on Google right now and spend 3 minutes, you'll find there's quite a bit of data. And I'm not going to go through pathways again. I know it's before lunch. I don't want to put everyone to sleep. But if this is a cell, just remember this. If you have blood sugar floating around and it's high, that creates insulin to try to pull the blood sugar into cells. Well, it also pulls that blood sugar into cancer cells. And all these pathways get activated. And it causes cell survival, cell growth, and inflammation. So the question is, can we stop those pathways through diet alone, or can we stop those pathways to synergize with cancer treatments? And the other thing is, all these downstream pathways from insulin, glucose, and IGF, whenever they're upregulated, they make the cancer cells a lot more resilient to what I do, to radiation, and they make them a lot more resilient to chemotherapy. So the thought is, if you do these nutritional changes, it can downregulate those pathways and then make conventional treatment like chemotherapy and radiation therapy work better. I like pictographs. Put more simply, access carbohydrates, access sugar. You get more blood glucose and you get more sugar in your blood. You need insulin to pull it in, and that causes obesity, inflammation, diabetes, and cancer. It's as simple as that. So if we can decrease one of those in the chain, we could ideally decrease the thing on the bottom there. This is nothing new. Again, Leo Tolstoy knew about this in the 1870s. My grandma, who is 92, knows that if she wants to lose weight, she's Southern Italian, she doesn't eat as much pasta that week. Tolstoy, as he said it, he had no need to be in strict training, as he had very quickly been brought down to the required weight of 160 pounds, but he still had to avoid gaining weight, and he avoided starchy foods and desserts. So why did Vonsky have to avoid starchy foods and desserts to lose weight? Because it downregulates that insulin pathway. Insulin is an anabolic hormone. It makes you grow. Bodybuilders like insulin when they're trying to get big and get big muscles, but it makes things grow, and when there's cancer cells around, we do not want growth. There are many studies showing this in humans. There's actually 28, I think now, randomized studies where we compared a low-fat diet, which I'm sure everyone in this room has been told is a healthy diet, versus a very high-fat diet with low carbohydrates, which many physicians, if they knew you're thinking about a diet like that, they would immediately lose all the hair in their head. Yet, when we look at the data, when you go on a very low carbohydrate, high-fat diet, glucose drops, circulating glucose, this is in humans, drops by about 15%, so that's less sugar around for the cancer cells in theory. And insulin, which can bind to those pathways and cause tumor growth, drops by 50%. And this is in humans. Now, this is not a study in cancer patients. These were in patients trying to lose weight and patients with diabetes. And there's a bunch of other benefits over here, and that's another topic for another day. But there is clear evidence that diet alone can decrease these pathways that we know upregulate cancer. And this pathway right here that was changed, lowered by 50% with diet, there are drug companies spending billions upon billions of dollars trying to find monoclonal antibodies and other medications that can block those pathways, which we know diet alone can do. And this actually has played out, and this is data on glioblastoma in adults, which is a very malignant, very aggressive tumor. This is from Johns Hopkins, and this is retrospective data, but basically there was 4 groups, and this is how long these people survived. So you want it further to the right, which means they were around longer. And again, this is a very, very, very aggressive cancer. These 4 quartiles, they basically took people's blood sugar levels, and they found that the lower their blood sugar was, the longer they lived. And it actually over doubled. The people with the highest blood sugar levels lived about half as long as the people with the lowest blood sugar level. So this already started to kind of raise some eyebrows where, something's going on here. This is going to be my busiest, most sciencey slide of the whole presentation, so bear with me here. But going back to that guy Warburg, he won a Nobel Prize in the 50s, and he showed that on the left here, so this is a normal tissue in your body. I stole this from sciencemag.org, so if this is a very boring picture, it's their fault for not making it as animated. But basically what he found, if this is let's say this is a muscle in your leg, and let's say you go for a sprint one day, you just run down the street real quick, and you're huffing and puffing, and then you feel that burn in your arm. That burn in your arm is lactate, that's lactic acid. And what happens is if you don't have enough oxygen going to that muscle, which if you go for a quick sprint, you can't get enough oxygen in, it quickly breaks glucose down into pyruvated energy into lactate. Okay, and that's glycolysis, anaerobic glycolysis, which means lack of oxygen. And it's good that we're able to do this because when you go for a quick sprint, it provides your muscles with energy. It's not the most efficient thing you can do though. You only get 2 moles of energy per glucose. Now, if oxygen is present, your body, instead of just burning the sugar real quick, it sends it over to this thing. It's called the mitochondria, and that's the powerhouse of the cell. And these are very efficient at creating a lot of energy, 36 moles of ATP, so significantly higher. And our body's smart enough to realize if oxygen's around, use these guys to make energy. Cancer cells don't care. This is what he found. Whether oxygen is around or not, they take glucose, they break it down, they make that lactate, that lactic acid that burns in your arms when you work out. And it's much less effective. And it's part of this whole, cancer cells just want to multiply, they just want to grow, they just want to take up sugar as much as they can, they want to eat it, get that sugar high and replicate. And this is what he showed about 50 years ago. And many people have actually taken this to mean why a lot of indigenous peoples did not get cancer back in the early 1900s when the British really started exploring around the world. This is Dr. Fouché, who was in Africa, he was a surgeon there, he was a district surgeon. He said out of 14,000 people, he never saw a single case of cancer in any form. People questioned him and said, maybe you just weren't looking enough. And he said, no, I was all of their surgeons, as well as many white and Europeans who were living there as well, who had cancer quite often. And it's somewhat of a stretch, but that's what people have attributed that to. And this has actually been shown in humans. 10 adults with pretty advanced cancer underwent a ketogenic diet under the guidance of Dr. Gene Fine, who's a great guy. And he basically showed that the less carbohydrates they ate, the more fat they ate, the more ketones they produced, which is what Miriam was discussing. These are these small energy sources. And you see what happened to their insulin. So their insulin was much lower. So again, we're giving people medications to try to lower insulin and try to decrease that pathway. But here's another study in humans showing that through diet alone, you can decrease those same pathways. And the problem here is, this is a 10-person study that took lots of money, lots of time, lots of effort. It's hard to do dietary studies in humans. But if you look hard enough, the data's there. And so I've presented this several times, and it's funny because the tomatoes that originally were thrown at me, they kind of stop after this study. But this is in mice. But what they did, they gave them brain tumors, gliomas, and they put these mice on a ketogenic diet, or they just did nothing. And they watched how long the mice were around for. And mice don't live very long, so it was a quick study. And they found that, as you see here, it moves to the right. These mice were alive a lot longer, simply from putting them on a ketogenic diet. Not a human study, a mouse study, but it's intriguing that diet alone would change the survival of these animals. However, when they gave them standard radiation and put them on a ketogenic diet, and I'm sorry to say at the end of these studies all the mice are sacrificed, but at 250 days, of the 11 mice on the ketogenic diet that got radiation, 9 of them had no tumor remaining on pathology. And this was the first to ever show that. Miriam discussed a study that showed they slowed growth in mice. This is the first one when they went back and looked in the brains of these mice, there was nothing left. So this was compelling data, to say the least, raising some eyebrows. This was done in Arizona at the Barrow Institute, and human studies are now following because of this. This was a study, another busy slide. This was a study we did at my prior institution at Jefferson with breast cancer, again in mice. But we systematically showed, this is the blue, and this is mice that are fed ad libitum, so they're allowed to eat all day long, as much as they want. And you see the tumor quickly grows to a large size. This is tumor volume, and just boom, it's up there. It's over 2,000 millimeters cubed in literally 25 days. You give the mice a little bit of radiation, it shrinks down. If you calorie restrict the mice, and this is basically an 80% carbohydrate diet, you just reduce the calories they can eat and give them a little bit of radiation. The tumor growth here is, sorry about that, the tumor growth is about half. So again, not only does it decrease the amount of tumors that happen, decrease the speed with which they grow, but given in the face of standard treatments like chemotherapy or radiation therapy, it works synergistically with these treatments. And a lot of these treatments, we've been trying for decades to increase the efficacy of these treatments, and if we could do that through diet alone, that could be very, very powerful. I published this study on looking at 7 of my patients that were on the ketogenic diet with glioblastoma, simply commenting on, did it have an effect on the blood glucose levels, and was it safe? And going back to that initial study, we know that patients that have higher blood glucose levels do worse. So the first question is, can we bring those blood glucose levels down? And the study showed, I looked at all of our patients, so there's about 300 patients to begin with. I had blood sugar data in depth on about 50 of them. And so these are those 2 marks from that paper. So people below this line of blood glucose do really well compared to people above this line of blood glucose that do really badly. And then in between it's kind of a mix. So really you want to be as much below here as possible. Before surgery, when patients come in and they get put on steroids, their blood glucose is very high. It's right at that danger spot. Before radiation, which is after surgery, pretty much all of our patients were above that marker that says you're going to do a lot worse. All the rest of the patients throughout treatment hovered about right there. So they're right in between where you do much better or much worse. All of the patients down here were on the ketogenic diet. Their average was about 15 below that marker. So in that other study, the patients that did the best with their blood glucose below there, all of the patients on the ketogenic diet were there. One patient had a blood glucose spike during treatment. That was the highest we got. It was still below that mark in that paper. So if all the 350 patients from Johns Hopkins, where the other paper came from, the worst patient on the ketogenic diet for 1 day was still below them. So is this going to correlate into increased treatment, efficacy, all these things? It's tough to say because it's only 7 patients. You really need a study of several hundred patients, which we're not going to get. So what we needed to keep doing is compiling anecdotal reports like this. But it was very clear, and this paper flew through actually. This paper got accepted. It kind of made up for that last one. And they said, wow, these patients are on high doses of steroids, and diet alone was bringing their blood glucose down, making their treatment much more safe because their blood glucose wasn't in a dangerous level, much more tolerable and with less side effects because of that blood glucose level. So heads are starting to turn now. The diet they were on, I won't go into this too much because Miriam talked about it, but it was about 77% fat, about 8% carbohydrate, and about 15% protein. And that kind of oscillated on a daily basis, but the carbs were about 5 to 10%. Here's a typical meal from one of the patients: coffee with cream, 3 eggs, bacon, cooked broccoli, Greek salad for lunch with olive oil, dinner, coconut oil, kale, salmon, and then for a snack, macadamia nuts. So not a terrible day, not a terrible meal. It does take some more preparation, but it does also make sure that you eat real whole foods. And then one last thing that I have seen, and it's hard to quantify this or present it, but the people that are on the diet and the families that are aiding their kids on the diet, or the families that are aiding their loved ones on the diet, and I'll get back to that in a second, but this is a paper that was in adults, elderly adults, with lung cancer, which is it's a pretty poor diagnosis, pretty poor prognosis. And they followed them out for 10 years, and they saw who lived longer and who did not. And these are two different groups. This one clearly lived a lot longer. You see it move to the right. A lot more patients in that group were cured. And the only difference between this group and the other group was that these patients, upon coming in and meeting with a psychiatrist, had a positive attitude. They came in and said, you know what, I'm going to beat this. I'm going to take care of it. I'm going to live and I'm going to be with my family. And they did. They lived a lot longer just based on that alone. And it's something that, you know, you can't put up graphs and flow charts and things to explain it. It just is. And this is again, I love pictographs. A positive attitude helps treat cancer. Optimism, we talk about the active patient. 20 years ago, a patient would come in with a GBM, a glioblastoma, and it was basically, we're going to put you on steroids, we're going to operate on you, we're going to give you chemo, and we're going to give you radiation, and you're just going to kind of sit there and take it, and it's going to beat you up, and that's it. And then you do it, and they go home, and they kind of sit on the couch, or they come into the ward. This is different. These guys or girls are, here's what I'm doing, doc. How's this diet? I'm exercising today. My family's doing it with me. Everyone's involved. Everyone's positive. They don't leave saying this is all doom and gloom. They leave saying we're going to beat this. We're going to work together. And in fact, it's infectious because other family members start realizing, diet and exercise matters. Being active, having good fitness habits, all these things. And it starts to multiply throughout families. I have a lot of patients that were on that study whose family members follow me on Twitter, and I check in on them every once in a while, and to see the changes that have been made from just going on a ketogenic diet that have just multiplied throughout their family, it's amazing, and there's no paper that's going to show that, and it's something that I think may be important than many of the other treatments that we do. So it's quite a large change on a lot of these people's lives and their families' lives. So I hope I didn't take too much time, but moving forward, the association between diet and cancer has been around for over a century. Keep that in mind if any physicians out there are telling you that there is no data, because there is data. Sugar can potentially fuel cancer cells and impede its treatment. I think we made that pretty clear here, I'm sorry. Ketogenic diet may synergize with current treatments, and there may be other diets that do too. We're just kind of scratching the surface. The role of the active patient and active family cannot be minimized. And if clinical trials are going on to answer these questions, be active, push them, get them in your local community. We need to prove these things so we can answer that question that is so vital for patients. I want to thank Justin. I've been talking to him for a while about all these things. The whole MaxLove Project. This is amazing. This is the advocacy that we needed within the field. And it's great to see that it's happening. Thanks to Dr. Shen and Children's Hospital of Orange County for inviting me here. I appreciate it. My amazing patients, of course, keep me going professionally and personally. I have to thank them. And this is Inuit Eskimos who are on a ketogenic diet. Not by choice, but I think they like it. Thank you.